Hello everyone. Now today we will be discussing about the glomerular disease. Since the glomerular disease is very high yield topic of USMLE and where you have to know about the nephritic syndrome, nephrotic syndrome and nephrotic syndrome, and the causes of them and their details will be very important while dealing the USMLE questions. Okay. So before going into the syndromes, let's discuss about certain term and their characteristic feature with example which will helps to understand in further explaining and further dealing. Okay, so first we know we have discussed in the previous lecture that there is the glomerular filtration barrier, and that barrier is composed of your endothelium, that is the blood vessel endothelium. Then there is the glomerular basement membrane which is made of type 4 collagen, and there is the podocyte which is layer which is also known as the epithelial layer. So this is the normal structure. The blood is here, present here. It passes from here through the glomerular basement and comes to the tubules. Okay, so this is the process of filtration. Okay, but if there is any damage, this is the normal process of filtration where there is the certain sizes by which there are negative charge, so positive charge doesn't get, then there is a certain size of the each layer which allows the fluid and other materials to be filtered out. But if there is severe damage, the damage may be occurring to the glomerular basement membrane, that is here, or damage may occur into the podocytes. Okay. If the damage is in the glomerular basement membrane, then it is known as the responsible for nephritic syndrome. And if there is a damage in the glomerular basement membrane, then there will be characteristic will be bleeding, and RBC will be leak out. Okay, we'll come here again and we will discuss there. If there will be a damage of your podocytes, then podocyte damage will be due to a nephrotic syndrome. Okay, so first let's discuss the term and then we will discuss again about it. Okay, now the type, when we talk about the type will be focal, diffuse, proliferative, membranous, primary glomerular disease and secondary glomerular disease. But the important thing to understand is focal, the word explained focal means a focus of certain area. So when we talk about the focal, then it means that this much area or this much area. So focus part of your glomerulus has been damaged. Okay, and that is known as the focal, which is less than 50% of the glomeruli is involved. If there is less than 50%, then it indicates that there is a focal damage. Okay, and the example will be focal segmental glomerulosclerosis. So you understood that if focal term has been used, then you have to remember, you have to imagine that okay, focal means the glomeruli which is present less than 50% is damaged, and that you have to make in your mind. Okay, an example of focal is focal segmental glomerulosclerosis. Okay, and which is responsible for your nephrotic syndrome. Now there will be another term is known as the diffuse, and diffuse means, since focal means less than 50 means diffuse means it is widespread. So diffuse will be more than 50%. Okay, and that more than 50% of the glomeruli involved, and that example is diffuse proliferative glomerulonephritis. Okay, and diffuse proliferative glomerulonephritis is responsible for nephritic syndrome and may even in severe case responsible for nephrotic syndrome. Okay, now there comes to the proliferative. Proliferative means there is something and that has been proliferative, that has been increasing. This is damage has occurred. Focal, this much part is damaged. Diffuse, damage has already occurred. Proliferative, there is a damage, but that has been also increasing as well. That means proliferative. And in proliferative, they are finding characteristics. Finding you will have the hypercellularity of the glomeruli, and example is membranoproliferative glomerulonephritis. This membranoproliferative glomerulonephritis is responsible for your nephritic syndrome, but in severe case can also lead to nephrotic syndrome, or which is known as nephrotic nephritic syndrome. Okay, now comes to the membranous. Membranous is this thickening of your glomerular basement membrane, this membrane. The thickening of the basement membrane will be the characteristic finding of your membranous, and example will be membranous nephropathy. Okay, and membranous nephropathy is example of your nephrotic syndrome, cause of your nephrotic syndrome actually. Okay, now there is a two term, that is a primary glomerular disease and secondary glomerular disease. You always know that in medical term, if the anywhere, any place, if the term comes the primary glomerular disease, it means that primary means that the disease of that same organ is responsible for the pathogenesis. Okay, and the secondary means that this organ is actually fine, but the secondary damage, secondary disease leads to the damage into that organ. Okay, so primary glomerular disease means primary disorder of the kidney and impacting the glomeruli. Example is the minimal change disease, which is responsible common cause of your nephrotic syndrome. Okay, and the secondary glomerular disease or the disease that has systemic disease and disease of other organ that has impact the glomeruli of your kidney, and the example will be SLE and diabetic nephropathy. Okay, so once we have understood these terms, the characteristic finding and the example, now let's move to our main topic. This is just an overview lecture, then we'll go in detail of nephritic syndrome and nephrotic syndrome, and in nephritic syndrome we'll again go in detail of each and every cause, their characteristic finding, and then we'll understand the detail of it, which will help us to solve the question of USMLE board. Okay, and even like in our daily clinic life. Okay, so now let's come to the three layer, that is endothelium, then the basement membrane and podocyte. There is also some heparan sulfate, and these all are the negative charges, so they are expelled out. Okay, the problem is that there is this 3 layers. If there is a damage in the glomerular basement membrane, then we have talked about that if there is a glomerular basement membrane damage, then that is responsible for your nephritic syndrome. And since nephritic syndrome, there is the disruption, there will also occurrence of your bleeding. Okay, and since bleeding will occur, there will be, look, what are the findings? There is a hypertension will be one of the finding. Increase in bond and creatinine will be since there is a damage, then there will be a increase in nitrogenous and creatinine level. There will be oliguria, there will be hematuria. I am talking about the bleeding, so there will be hematuria. Since there is a hematuria, this will get deposited into the cast and form the RBC cast in the urine will be found. Okay, the proteinuria will be in the soft nephrotic range, which means that there will be not so much of damage that albumin will be lost in the urine. There will be a loss, but it is not in the range of nephrotic syndrome. Means that there is not massive proteinuria. The protein lost will be less in the case of nephritic syndrome. Okay, then but in severe case, if the damage is so severe that the albumin will leak out, and in that case, then the albumin lost will be massive, which is also known as the nephrotic range. Okay, now moving to the examples of nephritic syndrome, or say the cause of nephritic syndrome, are acute post-streptococcal glomerulonephritis, and this is very much common. You have a lot of time you have known about this post-streptococcal glomerulonephritis, where there is a infection of the streptococcus that leads to the damage to the kidney. Even they said that there is damage to the heart, that is a rheumatic fever and kidney. Okay, so pharyngitis, that is responsible for rheumatic fever and post-streptococcal glomerulonephritis, but skin infection is only responsible for your post-streptococcal glomerulonephritis, that is kidney damage, but not to the heart. Okay, so we'll discuss in detail about it. Then there is a rapid progressive glomerulonephritis, then IgA nephropathy, also known as the Buerger disease, then Alport syndrome, then membranous-proliferative glomerulonephritis. Okay, the other two causes are diffuse proliferative glomerulonephritis and membranous-proliferative glomerulonephritis, but it can also be responsible for the cause of severe damage, and that may lead to the nephrotic syndrome. Okay, so nephrotic syndrome, what is the main problem? Nephrotic syndrome, this podocyte, which is also known as the epithelial layer, that is disruption. Since this is disruption, this charge barrier is impaired. And since charge barrier is impaired, now albumin was actually not due to the pore that was not coming out, it was due to the charge. Now since podocyte was responsible for your charge barrier, now since the charge barrier is damaged, now albumin will leak out. Okay, which means that in this there was a glomerular basement membrane damage, but here we are talking about the disruption of the podocyte, which is responsible for a charge barrier. And since charge barrier is damaged, the albumin was not coming into the urine because of the charge expulsion. But since now charge barrier is damaged, albumin will easily leak out. And since albumin is easily leak out, then there will be the massive proteinuria, and the protein will be 3.5 gram per day. Okay. So since there is a loss of protein, and in the protein the most commonly lost is albumin, so there will be hypoalbuminemia. Since there is a hypoalbuminemia, then you know that oncotic pressure of the kit in the blood vessel is measured by your major component is albumin. So albumin is responsible for oncotic pressure. Now since the albumin is not present in your blood vessel, what will happen? The force, there will be decrease in the, you know about the filtration pressure we have talked about, the hydrostatic pressure and albumin oncotic pressure. If oncotic pressure is less, hydrostatic pressure is high, water will leak out. Oncotic pressure is less, water will leak out. Since there is oncotic pressure is less, now water will leak out and will be responsible for edema. Okay, then there will be other, since there will be less albumin, now hyperlipidemia and hypercholesterolemia will be occur, that will be synthesized by the liver, and there will be a finding of hyperlipidemia and hypercholesterolemia. Okay, so to remember this, you can even remember that since there is a protein loss in your protein has lost into the urine and leads to the hypoalbuminemia. Now kidney, since blood has get thin, now the liver in try to compensate it. This is just to remember, compensate it throw out the some other material, that is the liver has this cholesterol and lipids. So this lipid and cholesterol get increased. It is just to remember that what are the other findings, right? Because we can easily remember that it is massive proteinuria, so that hypoalbuminemia has led to the edema. These are lost, but in contrast there will be hyperlipidemia and hypercholesterolemia, that you have to remember. Okay, and which is high yield as well. Now coming to the causes may be primary or secondary. All the causes are responsible for the primary damage of the kidney or from the systemic disease as well. The example are focal segmental glomerulosclerosis, minimal change disease, membranous nephropathy, amyloidosis, and diabetic glomerulopathy. We'll come and discuss in detail about it. Now coming to about the nephrotic and nephritic syndrome. Nephrotic nephritic syndrome is simply the thing that is including. This is the diagram, the chart in your FA, and you can easily see it. This line indicates that there is a nephritic syndrome initially, and it was a severe damage, and that has led to the nephrotic syndrome and loss of protein in the nephrotic range. Okay, so severe nephritic syndrome with profound GBM damage. Since your glomerular membrane, if a lot of damage is there, now this all is, if suppose this portion is damaged, now from here everything will be gone. Okay, so GBM damage that leads the glomerular filtration charge barrier, leading to the nephrotic range of proteinuria. So you understood? There is a profound damage of your glomerular basement membrane that has also even damaged your charge barrier, and since charge barrier is now damaged, it has led to the leakage of the protein in the nephrotic range. Okay, with the feature of nephrotic syndrome, and the classical example of this nephrotic nephritic syndrome is diffuse polyphatic glomerulonephritis and membranoproliferative glomerulonephritis. In nutshell, it is saying that the nephritic syndrome, all causes of nephritic syndrome can lead to the nephrotic syndrome in severe case, but the most common nephritic syndrome causes that will lead to nephrotic syndrome are these two, that is diffuse polyphatic glomerulonephritis and membranoproliferative glomerulonephritis. So this is just an overview of our main topic of nephrotic syndrome and nephritic syndrome, and we'll discuss in detail in next lecture. Okay, thank you.